Patients can save, according to the Western Europe or US, UK, up to 50 and 70%.
Dental work in Budapest is not just affordable. There are 23 more truths you need to know before you visit Hungary for your smile makeover. Don't miss point 15th if you're nervous around dentists.
I'm a bit nervous because to be honest, because my English is very poor and I'm afraid that I won't understand everything or I don't know the proper answer for it. My name is Dr. Kornelia Juhasz and I have graduated in the Semmelweis University here in Budapest. And after I made my specialization, my postgraduate studies I have done in oral surgery and implantology, and I have more than 10 years experience right now in dentistry.
Excellent, Doc. If you can also share with us if you're a part of any dental organizations, might be local or international.
I am a part of the Hungarian Dental Associations and I really participate in international congresses and trainings as well.
Why do you think your country is just really a popular destination for dental tourism?
So Hungary has a long tradition in dental tourism and we have really highly trained doctors. So our university is worldwide popular and famous because of their doctors. And of course we have modern clinics. And additionally, we have so much less prices comparing to the worldwide prices. Patients can save, according to the Western Europe or US, UK, up to 50 and 70%.
From which countries do your patients normally come from?
Normally we have patients from Germany, Switzerland, Austria, UK and the US.
Why do you think also the cost is just really affordable in Budapest compared to other regions?
Because we have lower operating costs and living expenses. So everything is much cheaper here. And that's why we can offer our treatments much more affordable for the patients. But this is the exact same products, exact same materials, brands, what we use, like as the worldwide countries uses.
What are the mode of payments you accept at the clinic?
We accept cash, credit or debit cards, and also bank transfers. You can pay by cash in euros and Hungarian forints, which is the local currency, or if you choose to pay by debit or credit card, transactions will be charged in your local currency, depending on the bank's settings.
What makes it stand out from all the clinics in Budapest?
Our clinic combines personal care with modern technology and highly experienced doctor, as I mentioned before. And we treat every patient as an individual and not just a case. And we really highlight the patient experience here. And we really want to have the patients to realize the treatment as comfortable as possible.
If you can share with us also, when was the clinic established and what modern technology or equipment that you use right now?
Yes, the clinic was established in 2018 and we use Nobel, Straumann, Alpha Bio implant systems, of course CAD/CAM designs, EMS, blank one systems and Cavo chairs. And of course, digital smile design tools. Our dental laboratory is fully digitalized. So everything will be done in CAD/CAM and they're 3D printed models. And of course, we use the digital smile makeover tools and protocols. And of course, the navigated implantation also available by us.
One of the questions also is about sterilization. If you can also share with us the sterilization procedure you follow right now at the clinic for standards.
Yes, the ISO standards are also available for us and not available, we use these. So international sterilization standards with autoclaves and strict protocols we follow.
What are the most popular procedures your clinic offers at the moment?
At the moment, the all-on-4, the implantations, then the crowns, the veneers, and of course the smile design makeovers.
what is really the dental implants? How do they work and when are they required by a patient?
You need a dental implant when you have single missing tooth or all teeth maybe has to be extracted because some reasons at all from the upper or the lower jaw, so empty jaws. And this also can be a good solution to regain the bite function because it is the same how it works and you don't feel it. Whether it's a natural tooth or an implant tooth, you cannot differ. So that's why it is really comfortable for the patients and that's why it is really popular for choosing this. And also preserves the jawbone, protects the adjacent teeth and offer a long-lasting and natural-looking smile.
Can you share with us all the different implant procedures you offer? Because we have like all in 4, all in 6, all in 8. So if you can mention everything that you offer at the clinic.
Yes, we provide, of course, single tooth implant, and this is where you have some or one missing tooth. So one implant or 2 implants with a bridge, it's a solution for several tooth missings. And as I mentioned, when you have no tooth or they have to be extracted for some reasons, the all-on-4, all-on-6 or might be the all-on-8 a good solution, but with less implants, also we can provide the same quality, so this means less cost for the patients. So all-on-4 and all-on-6 are the most popular. It depends on the remaining bone, which one we can use, and also by the costs.
How do you actually really decide if a patient requires all-in-4 versus all-in-6?
All-on-4 is recommended when the patient has limited bone volume. So this is for less bone, the all-on-4, but it is still sufficient to support the implants. So 4 implants in the 2 with angled and 2 with straight can be placed in the jawbone, and all-on-6 is for more bone. So I recommend it when patients want more stability, more implants. It is more durable, of course, but therefore we need more remaining bone, more bone. This means from the patient's side, or we can use it with bone augmentation as well.
Apart from bone level, what are the other criteria that makes a patient a good candidate or not a good candidate for implants?
I will mention the not good candidate because if you are excluded, then it is less. So most of the patients can be chosen for implant patients. If you have uncontrolled diabetes or untreated gum diseases, can be excluded, or you have insufficient bone volume where bone grafting can be not a solution, or you have poor oral hygiene, you are a heavy smoker. These are the no-goes.
Do you have usually like an age limit of, oh, you're too young or you're too old to have implants?
Yes, age limitations are valid, but not too old. Nobody is too old for the implantation. Some of the patients think that, oh, I am too old to have an implant because my bone quality is so poor and it won't incorporate into my body. Yes, it will. It does. But by the young patients, their bones are still growing, and that's why we cannot place implants too early, because if we place it, the jawbone will grow and gaps may occur into between 2 teeth.
Now, let's say, Doc, I'm a patient or I'm a potential patient for dental implants. If you can share with us like the step-by-step process of how you will assist me, like first into consultation and then getting my x-rays, or if you can just show the step-by-step process.
How we choose the candidates for dental implants is like, firstly, by first visit, we do physical examination. If you do not have any gum disease or you have a good oral hygiene, yes, of course, we can go forward. This means first the CT scan can decide if you have enough bone, quality and quantity. And if you have enough bone, let's go further. Let's plan the implants digitally. We can use navigated implantation as well, or just a manually handled one. We plan the implant positions, where is this the best, the angle and the sides where we should place him. And then comes the surgery time, and we do the surgery, we insert the implants into the bone, and then comes the healing session. It takes months.
And then after months of healing, I know it usually takes like 4, 5, or 6. It really depends on the patient.
Depends on whether it is implanted into augmented bone or own bone.
Excellent. And then when they come back for the second phase, what's the setup now? Like, how do you check again if they're already ready?
Of course, yes, of course. We do a control X-ray, and it makes us visible how the implants are also integrated or not. Normally, we have no problems with the implants. And then comes the liberation phase. We open up the implants and we make a reach for the implants inside, screw, and then we make an impression digitally by the oral scanner with scan buddies, and then we send it to the lab. And then comes the laboratory phase, and the patient comes back for a try-in. We control the size, the shape, we see it for the facial symmetry, whether it passes or not, and then we do the crowning ceremony. This means the patient gets back her or his smile.
Usually, how long does it take for you to fabricate the crowns for the implants?
It depends on how many crowns the patient needs. For a few crowns, for several ones, it takes 5 workdays, so altogether 1 week. But if it is a smile makeover, it is 10 workdays.
The implant brands that you mentioned earlier, Doc, do they also cover warranties, or how does warranty or coverage works with implants?
Of course, they have a lifetime warranty for the implant materials. So this means the patient doesn't have to worry about if their implants go wrong. This means some breaking or some chipping or something. What is wrong with the implant? The implant brands are providing a lifetime warranty for it.
Now, let's talk about the surgery itself. Of course, most patients, they know when they visit the dentist or the clinic, it relates to pain. That's also my fear. But how do you prepare patients who may be nervous about undergoing oral surgery? How do you calm them?
There are 2 options. There is a solution by us for general anesthesia for really scary patients, and for those who have only just a small fear, we have calming tablets to use, and this is a really big help for the patients mostly.
Now, of course, every patient is different, and I know you take precautions also for every surgery. What steps do you take to minimize complications, at least during and after surgery?
As we mentioned, that we have strict protocols for not just disinfection, just sterilization protocol. So we prepare the chair and the treating room, everything is sterile. And we prepare the patients also intraorally and extraorally, also decontamination, disinfection. And then we start the sterile process, and we keep the sterile everything until the end of the surgery. After that, if the patient needs, we use antibiotics, of course.
What are really dental crowns and veneers, or what's the difference?
We recommend crowns mostly for functional reasons, where the bite function has to be redone. So when most of the tooth surfaces are missing, it is not enough for a filling, even not enough for an onlay. It has to be overcrowned to maintain the chewing function. This is for molar regions. For misalignments, we can also use the crowns to straighten the smile, to regain the shape, the size, and the color of the tooth from the natural looking tooth. And veneers are mostly for the aesthetic version, not for the function.
Excellent, Doc. And what also are the different crowns or veneers that you use? Like I know we have Emax or porcelain. What types do you use?
The crowns are mostly made from full zirconia because it is more durable and strong material, and even though it is really aesthetic can be. So that's why this is the mostly used material by our clinic. But if the patient have high aesthetic requirements, of course we provide it, and this is for the emax porcelain, whether crowns or veneers. If there is no solution for a veneer, it should be a crown. But since it is a ceramic, it only can be in the front region, the aesthetic region.
Absolutely. And you shared earlier, Doc, how fast is it you fabricate the crowns? Is it also the same time frame for veneers?
Yes, because for the dental, it takes the quite same process from the digital oral scan and from the fabricating. So 5 birthdays for a few veneers and 10 for total smile makeovers.
Now let's talk about digital smile design, or as they say, Hollywood smile design. If you can share with us the process. Let's say I'm going to be your patient. What should be the first step and what should we do?
Yes, firstly, we need to consult about your willings, about your thoughts, how you want to have your smile. And for this reason, we take an oral scan and we make the digital smile design. And then you can differ, you can compare the before and after, where you want to reshape more. I need more bigger tooth, I need more longer tooth. And then comes the visualization with the mock-up, with the 3D printed model. It helps us. And it makes more visible for the patient when they can see in their mouth properly how it will look like, really. And this is for the mock-up. And we make a try-in into the mouth, and the patients can more differ, not in the screens, more in their mouth. Okay, at the screen it was look, but in my mouth it doesn't look so nice. So I need here a little bit more adjustments and there. And whether the patient needs more adjustments, we send back to the lab, we do a new mock-up and a new digital smile design. And then by the mock-up, we do the preparation, again, the new oral scan, and then comes the laboratory phase.
Excellent. So in total procedure, Doc, how many days should they normally be in Budapest for the whole process?
Whether it is approximately 10 veneers, first day will be the consultation and the oral scanning. Second day will be the digital visualization and the mock-up, so the patient can see at the screen and also in their mouth how it looks like. And at the 8th working day, there is a crowning ceremony, so where we give the veneers for the patients, we glue it in.
One of the commonly asked questions also is about the post-op follow-up care, because of course they cannot really stay in Budapest that long. If something happens or they have like questions or concerns, they cannot really just fly back in quickly. But how do you provide assistance post-op, especially let's talk about first implants? How do you give them guidelines on how to take care of themselves while in the process of getting the implants?
There's a written guideline written by me, by our clinic, where I really declare what are the common may-occurring possibilities, what the patient can experience after the surgery. Of course, the most common is mild discomfort, swelling and bruising. Yes, these are almost for every implant patient or who had a surgery, but it is really safe with the stitches to fly back home because the wound will be closed and everything can heal underneath it. So we give a detailed aftercare instructions, what to do, what not, what to avoid. So everything is written so the patient won't forget it.
And do you also provide them the whole information of like what size of implant we use, the specific type, so that just in case something happens?
Yes, of course, it is necessary, it is mandatory to provide the patients an implant passport, it is called, and there are stickers in it, what gives for the future dentists an information, what kind of screwdriver they may use, so everything written, what diameter, what length, everything what is necessary for the future dentist information. And also we can provide for the patients every information about the procedures have done and any relevant medical notes as well.
Just in case they want to speak to you, just like if they have like direct questions, how can they like reach out? Can they just send you like an email, or can they contact you in WhatsApp, or your coordinator maybe can arrange?
Online consultations we can done, of course. And also I am also curious when the patient has problems, it is also better to see in real time, okay, how it is look like, or it is whether it is normal, or you should visit a nearby doctor, maybe it's a problem or not. And of course in written version via emails.
As we all know, there's no bad time, of course, to visit a beautiful country, especially Hungary. But in your recommendation, when is really the best time to visit Hungary or Budapest for dental treatment?
Throughout the year, patients are coming, but mostly in summer and autumn are especially popular for dental tourists.
One of the common questions that we do get, like, what's gonna happen if I'm there? Would someone assist me at the airport, something like that?
Yes, of course, we have a partnership with a professional transfer company, so we do help for the patients from the airport transfer. The driver will meet you up at the airport and you picks you up and drives to the dental clinic if you have right the appointment, or to your hotel. We help in the accommodation as well, and then the local guidance as well.
Apart from you, well, you mentioned Doc, you don't speak good English, but you do speak good English. But all the staff also knows how to speak English, or if just in case they need translators, would you be able to provide translators if needed?
Yes, we do speak English and German, and any other languages translators we can provide.
We'll just talk about your recommendations for must-visit tourist spots in Budapest or in whole Hungary for people who want to visit and have their vacation at the same time with the dental treatment. What places would you recommend?
Budapest is a very beautiful city, but there are recommended parts, for example, St. Stephen's Basilica and Parliament of Hungary. It is really beautiful from the Danube River front, and also the entire Danube River front. It's really beautiful. Buda Castle with the Fisherman's Bastion. It is a popular sightseeing spot. And also we have a lot of thermal baths. This is also good, but it isn't recommended for the surgery patients. It is for the crowns and veneer patients.
And near the clinic, do you also have like nearby places where they can shop or dine while waiting in between appointments?
The clinic is in the central part of the city, so everything is in the nearby. This means they can shop, they can dine, and the most popular sightseeing spots are in the nearby. Maybe the Váci Street and the Andrássy Avenue can be good for shoppings, maybe.
One of the common things also that we do see is, of course, our patients usually travel alone. So if you have like safety tips, especially for solo travelers or women who visit countries on their own, do you have any safety tips for them?
Budapest is generally really safe and really welcoming town. We recommend the same common sense precautions for the solo traveler patients. This means you have to take care of your personal belongings. Do not walk late night at the less populated neighborhood or poorly lit areas. To use official taxis and ride-hailing apps. So that's the normal precautions for everybody.
What inspired you to pursue dentistry?
I chose this profession when I was 14, and I wanted to be a doc because I wanted to acquire a big knowledge, and I was interested in biology, and I wanted to have a profession which is productive, which is manually, where I can use my creativity, and also to be a doctor. This is really cool, and I love to help by the patients to regain their smile and healthy and self-confidence as well.
Another curious question, if you're not wearing your gown and you're not at the clinic setting and you're outside, what keeps you busy or what do you do most?
I really like to travel and to do sports to maintain my health, of course. And I love spending time with my family.
So if you want to encourage them to go to Budapest and have their treatment with you, doc, how would you encourage them?
You can choose this country and this town because Budapest is a metropolis, we can say. So this is a really big town. You have so many possibilities if you want to be as a tourist, but as a dental tourist also good solutions. As mentioned before, we are highly trained doctors and we have modern clinics and really equipped dental staff, so everything in digitalized version. So these are both good solutions for the patients.
Excellent, doc, and we did it.
Yeah.
Get a great smile with DentaVacation. Visit a hand-picked dental clinic today.